Hi, everybody. It's Nigel Giam here, the lead GP training program for St Mary's and director for Mentor MRCGP. I'm very happy to have Faisal here, who is completely overdressed for this occasion and makes me feel very underdressed at the moment. But Faisal, lovely to have you here. It's so nice. And congratulations, firstly, on your pass for the AKT. And
Yep.
so now more recently in the recent SCA sitting, that pass also. I'm very, very happy for you. Um, Tell us a bit about yourself, because obviously, I know we first came across each other when you were having a bit of problems with the AKT. So
Yep.
maybe we can start off there, and then we can move to the SCA.
Absolutely. And good evening to you and then everyone else watching us. Well, where do I start? I'm actually very happy for the developments that you have actually enumerated. So I remember first contacting you somewhere around July or August
Yeah.
because I was very much in despair. And that was because as an ST2 about to get into ST3, I had unfortunately not passed my AKT on the first occasion. And then at the back of my mind, I also had the SCA to focus on. So that was more of a double whammy for me. And
Yeah.
I was very desperate for, some form of strategy or some form of information that I could work with. And I mean, speaking from my perspective of an international medical graduate, it sometimes is difficult to be able to get, programs that actually give you the required tools to, crystallize the information that you could use to do, let's say, the AKT and the
Yeah.
SCA as well. So
Yeah.
I reached out to you, and I was so happy I did because your courses were invaluable to my success. I mean,
Oh, thank you. That's really kind of you. And actually, you had such a lovely energy, even though it was all virtual. And it's so weird, isn't it? Because we've never actually met face to face, but I feel like I
yeah,
know you so well anyway, just through our contacts and WhatsApp messages. So the
yeah,
AKT now out of the way. Let's focus on the SCA, which you passed the first time round, which is absolutely fantastic.
yep.
Can I just ask, what do you think the challenges are for IMG study groups, IMG graduates when they approach this exam? Because obviously we know there's an issue here. What do you think the main issues are?
Well, I think to start off with, the main issues have to do, first of all, with an orientation of what exactly this exam requires.
Yeah.
For example, when I first approached you regarding the SCA, I had in mind that this was one of those exams where you had to take a presenting complaints, history of
Yeah.
presenting complaints, more of a diagnostic driven exam that we've
Mhm.
been so used to and accustomed to throughout medical school and practice up until this point. But then that was when when I encountered you and you advised me, you told me that this was actually a narrative driven exam, and this was and the approach was to look at it the patient holistically from a psychological perspective, from a
Mhm.
social perspective, not just trying to chase a symptom down and trying to arrive at a specific diagnosis. So it was from you that I realized that this was actually about situational awareness and about managing issues and the narrative rather than chasing a symptom and trying to make a diagnosis that you might not even arrive at the end of the day.
Wow, you've absolutely nailed that summary. I'm seeing a new course organizer coming through here. I'm going to be out of a job soon. That sounds fantastic. No, you've absolutely nailed that. I mean, absolutely narrative driven is what GP is all about. So
Yeah.
maybe we can just hone it in and talk about, I suppose, your top tips for these three domains. In terms of data gathering,
Yep.
what's your approach to that? How did you optimize your marks?
Yeah. So specifically, I think you mentioned during the course, and I'm sure if you had a pound for every time you mentioned the word strategy, I'm sure you'd be a millionaire by now.
I
You
wish.
yeah. You made it clear that we needed a strategy, we needed a battle plan for every single case that we encountered. And for me, that was very helpful because then with the 3 minutes that you have with the information before getting into the patient, I realized that what is this all about? Trying to get a sense of what the narrative could be
Love it.
and what the patient would be looking for, what was to be done for a patient A as opposed to a patient B. And one thing that you also mentioned during the mantra, I mean, one of the course mantras was that you should get your eyes early, the ideas, the concerns, try and set the agenda and the tone for the discussion to go on. And that really helped me in gathering the data because it was focused. And to be honest, in many of the cases, I wasn't too sure because if someone says they have a headache, it's a million things.
Of course.
And in 12 minutes, you can't talk about a headache in its entirety. But then if you got to understand what the patient thought about it and probably what they were expecting you would do,
Yeah.
and also have a sense of what, these expectations mean to the patient, then you could actually manage the issue and be a patient-centered doctor.
I love that. I think that's great, actually. That's fantastic that you've actually centered your consultations on the patient's agendas rather than our own, which probably leads us a bit more now, actually, to the relating to others domain. So you've considered obviously how you open up ICE
Yeah.
earlier on. What did you then do with ICE once you've elicited it? How did you maximize it to your advantage?
Yeah, I was waiting for you to answer this question. So ask this question actually. So then what I did was, once I did the open-ended questions and I gathered the information with regards to ICE, I knew at the back of my mind that you would have to readdress the ICE in management, but which we would come to shortly. But then what I tried to do in the middle was to a bit of a synthesis. So I was like relating to others. I think that's what you mentioned,
Yeah,
relating to
right.
others. So this also is a challenge for international medical graduates in the sense that, we are from different cultures. We have different ways of expressing empathy. I'm from a country called Ghana, and we are quite soft-spoken, and we do lots of body language and gestures.
Yeah.
So what I thought was, why not use those skills to see if that could optimize my ability to relate to others? Because essentially communication has a non-verbal component to it as well.
Absolutely.
And so I realized that all this, okay, tell me more, could actually be points of strength that I could allow to shine through in the consultations. And that's exactly what I did. And that was thanks to you because you mentioned that the only way you can make a patient feel better is actually if you do feel good yourself. And if you feel good, you can transfer that energy and the patient automatically feels better for the consultation they've had with you.
I love that you remembered that quote from me because your energy, I remember, was so vibrant, and so much of it, as you say, is a non-verbal cues, and actually so much of it is in the eyes, isn't it? Because you smile. Well, Confucius says if you smile with your eyes, you smile with your heart, which is great.
Absolutely.
And you were doing a lot of smiling on that day, I remember. It was fantastic. So if we come to the last domain of clinical management, which I think you've now kind of alluded to, is not just the symptom or the diagnosis, but the situation. And I want to focus on this in particular because a lot of the SCA tests you on, I suppose, managing or negotiating through difficult situations. What was your kind of game changer for that?
So the game changer for me was readdressing ICE. So then I think I also learned this on the course, how to introduce your management. And so I went like, I know you think this is a brain tumor, but actually what's reassuring is you don't have this, that, and it's actually likely to be as a result of something treatable, like maybe a migraine or something. And so the beauty of it was the fact that after actively listening to the patient and gathering their eyes and trying to understand the psychosocial aspects, I could now zone in, readdress, and apply the NICE guidelines to it. So for example, rather than just saying, oh, you should get some exercise, you mentioned you liked horse riding.
Yeah.
Is this something you'd want to do more frequently?
Yeah.
Because I want you to exercise maybe 5 times a week. And that was so beautiful because you could see that then the role players lit up, they had a smile on their face. And that's also another important thing in the management that I could kind of see that they were kind of urging you on or giving cues. When they were like, no, doctor, that's not what I said. Then you realize it's a cue to get back on track. So staying close to the narrative. There was the aspect where knowledge came to play, and that's thankfully I had just passed my AKT, so the knowledge was there. But to synthesize that with the empathy, synthesize that in a big equation with addressing ICE was really the game changer for me.
You're so right, isn't it? Because actually you can't have a strong clinical management section unless you have a good relating to others section, because that's the glue, as you say, the synthesis that holds all of these three domains together. I'm so happy for you, Faisal. AKT, SCA, done. What's the plan now? What's the plan? You're dressed so smart. Where are you going?
So the plan now, it's a lot of things come to mind. Even right before I got into training, I did this postgraduate diploma in dermatology with
Oh,
Cardiff. And
fantastic.
so now that the exam is out of the way, I'm thinking of how to, infuse my GP practice with some dermatology
Oh,
elements, maybe with a special interest in them.
yeah,
So I have a lot of interest in medical education and public speaking, things like that, which I'm sure we could talk about
absolutely.
as well, exactly.
You speak incredibly well, I have to say, better than me. So that's
Never
fantastic.
never outshine the master.
Oh, you're too kind. You're too kind. Well, listen, Faisal, thank you for spending this time with us. It's been inspiring and actually just lovely to see you again. That lovely energy in your eyes, and that's going to be very inspiring for everybody. I wish you the
Yes.
very best of luck, and please keep in touch. Thank you so
Thank
much.
you very much. And in my final comments, I'll just say that, well, first of all, thank you very much because I was, when I missed out on the first AKT by 2 marks, I just felt the world crumbling down. But then you taught me to be strategic, utilize the little energy you have and be smart about it. Have a battle plan. Use the college resources, first of all, for the AKT. And once I had crossed that, river, I knew that you would be the same person to help with the information that I needed to get on board to cross the SCA as well. So if there's anyone who is having issues with these exams, it's doable because I was able to pass these two in a span of 4 to 5 months, and I'm quite delighted about that. So
So
in
are
all,
we.
there's always hope. Once there's a will, there's a way.
Absolutely, there is absolutely always hope, and energy creates energy. Thank you so much for your energy tonight. Thank you so much. Take care. Bye now.
Very much, Nigel. Take care.
Bye.